the thorax and lungs for nurses. Hello everyone and welcome to this presentation on the thorax and lungs. Today we will be discussing the anatomy and physiology of the thorax and lungs, how to perform a thorax and lung assessment, and what normal and abnormal findings may indicate. We will also talk about the impact of spine issues like scoliosis on breathing, chest types like barrel chest and its cause, and lung sounds by area of auscultation. Anatomy and physiology. The thorax, or chest, is made up of several structures including the rib cage, sternum, and thoracic vertebrae. These structures protect the lungs, heart, and other vital organs. The lungs are a pair of organs located in the thorax, and they are responsible for the exchange of oxygen and carbon dioxide in the body. The lungs are divided into lobes, with the right lung having 3 lobes and the left lung having 2 lobes. The bronchial tree is a network of tubes that lead from the trachea to the alveoli, which are the site of gas exchange in the lungs. Common respiratory illness. There are several common respiratory illnesses that nurses may encounter during patient assessments. Here are some of them. 1. Asthma, a chronic respiratory disease characterized by inflammation of the airways, which can cause difficulty breathing, coughing, and wheezing. 2. Chronic obstructive pulmonary disease, COPD, a group of lung diseases, including emphysema and chronic bronchitis, that can cause breathing difficulties and reduce lung function. 3. Pneumonia, an infection of the lungs that can cause coughing, fever, chest pain, and difficulty breathing. 4. Tuberculosis, TB, a bacterial infection that primarily affects the lungs, causing coughing, fever, weight loss, and fatigue. 5. Influenza, a viral respiratory infection that can cause fever, coughing, sore throat, fatigue, and body aches. 6. Respiratory syncytial virus, RSV, a viral infection that can cause respiratory symptoms similar to those of the flu or a cold, especially in infants and young children. 7. Bronchiolitis, an inflammation of the small airways in the lungs that can cause wheezing, coughing, and difficulty breathing, especially in infants and young children. During assessments, nurses should monitor the patient's respiratory rate, rhythm, and depth, as well as assess the patient's oxygen saturation levels, lung sounds, and any signs of respiratory distress. Additionally, nurses may collect sputum samples for laboratory analysis and perform chest X-rays to help diagnose respiratory illnesses. Treatment options may include medication, oxygen therapy, breathing exercises, and/or pulmonary rehabilitation. Assessment. Inspection. When performing a thorax and lung assessment, start by observing the patient's breathing pattern, chest shape and symmetry, and any signs of distress or use of accessory muscles during breathing. Then, you will perform percussion, palpation, and auscultation of the lungs. Impact of spine issues. Spine issues such as scoliosis can impact breathing by reducing lung capacity and causing difficulty in breathing. This is because the abnormal curvature of the spine can compress the lungs, making it harder for them to expand and contract properly. Individuals with scoliosis may experience shortness of breath, chest pain, and fatigue during physical activity. Barrel chest. Barrel chest is a chest shape characterized by an increased anteroposterior diameter, giving the chest a rounded appearance. This can be caused by various conditions such as chronic obstructive pulmonary disease, COPD, asthma, or cystic fibrosis. Barrel chest can impact breathing by reducing lung capacity and making it harder for the individual to breathe properly. It is important to document any signs of barrel chest during a thorax and lung assessment and report them to a healthcare provider for further evaluation and treatment. Breathing difficulty, also known as dyspnea, can present in various ways depending on the underlying cause. A patient may feel like they are struggling to catch their breath, experience shortness of breath, or feel like they cannot take a deep breath. They may also exhibit chest retractions, which are visible inward movements of the chest during breathing. Patients may display behaviors such as pursed lip breathing, using accessory muscles to breathe, or appearing restless or agitated due to the sensation of not being able to breathe properly. In some cases, patients may also experience anxiety or panic due to the sensation of breathlessness. Difficult breathing can also be a sign of various respiratory chronic obstructive pulmonary disease, COPD, and bronchitis. Asthma is a chronic condition that causes the airways to narrow, making it difficult to breathe. Symptoms may include wheezing, coughing, and shortness of breath. COPD is a group of progressive lung diseases that includes chronic bronchitis and emphysema, which can cause symptoms such as coughing, shortness of breath, and wheezing. Bronchitis is an inflammation of the bronchial tubes that can cause symptoms such as coughing, difficulty breathing, and chest discomfort. The position of the patient can also affect their breathing. For example, lying flat on their back may worsen breathing difficulty for some patients with certain lung or heart conditions, while sitting upright or leaning forward may provide relief by allowing the chest to expand more fully. Percussion. During percussion, you will tap on the chest to evaluate the density of underlying tissues. Percussion is a technique used during a thorax and lung assessment to assess the density of underlying structures by tapping on the chest with the fingers. When percussing the thorax, healthcare providers listen for specific sounds and note their location to detect any abnormalities. A resonant sound is heard when percussing over normal lung tissue, which indicates air-filled tissue. A dull sound, on the other hand, may indicate consolidation of lung tissue or fluid in the lungs. This can be a sign of pneumonia or pleural effusion. A hyperresonant sound may be heard when percussing over an area with overinflated lung tissue, which can occur in patients with asthma or emphysema. By assessing the percussion sounds in different areas of the chest, healthcare providers can detect abnormalities in the lungs and other underlying structures. This information can help guide the diagnosis and treatment of respiratory conditions and other health issues. It is important for healthcare providers to have a thorough understanding of thorax and lung assessment techniques, including percussion, to provide the best possible care for their patients. Palpation. Palpation involves using the hands to assess the chest wall and identify any tenderness or masses. Providers would also assess for crepitus, which can indicate rib fracture, equal rise and fall of the chest, and tactile fremitus. Auscultation. During a thorax and lung assessment, it is important to auscultate the lung sounds in different areas of the chest to detect any abnormalities. Decreased lung sounds in certain areas can indicate various conditions such as pneumonia, atelectasis, or pleural effusion. Normal and abnormal findings. Normal lung sounds include vesicular breath sounds, which are heard over most of the lung fields, and bronchial breath sounds, which are heard over the trachea and large airways. Abnormal lung sounds include crackles, which are caused by the movement of fluid in the lungs, and wheezes, which are caused by the narrowing of airways. Other abnormal findings during a thorax and lung assessment may include asymmetry in chest shape or movement, tenderness or decreased breath sounds in certain areas during auscultation. Abnormal findings may indicate various conditions such as pneumonia, bronchitis, asthma, or even lung cancer. It is important to document any abnormal findings and report them to a healthcare provider for further evaluation and treatment. Conclusion. In conclusion, the thorax and lungs are vital structures in the body that are responsible for the exchange of oxygen and carbon dioxide. During a thorax and lung assessment, it is important to observe the patient's breathing pattern, chest shape, and perform percussion, palpation, and auscultation of the lungs. Normal and abnormal findings can indicate various conditions and should be documented and reported to a healthcare provider. Spine issues such as scoliosis can impact breathing, as well as chest shapes like barrel chest. Thank you for watching this presentation on the thorax and lungs.